Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Sangeeta Pati. Dr. Pati is a Georgetown-trained physician, board certified by the American Board of OBGYN and Anti-Aging Medicine. She practiced evidence-based traditional and alternative or natural medicine for many years in the Washington, D.C. area. She has published in numerous medical journals and travels internationally educating physicians on bioidentical hormones. Dr. Pati, welcome to the program.
Thank you.
How did you go from a traditional OBGYN practice to what you're doing now?
Well, there were actually three major events in my life that changed my practice from a very traditional medical model into integrating evidence-based complementary medicine into the practice. And those three events were, first, my experience with medicine abroad through quite a bit of nonprofit work that I did over my years of practicing as an OBGYN. The second event is the publishing in 2002 of the Women's Health Initiative study, which created a major concern for those using hormonal therapy and propelled a mission on my part to really find the evidence behind bioidentical hormones. And that piece of the story is actually quite interesting because I think many OBGYNs went through that sort of transition, at least the experience of having women call that morning that WHI results were released.
Now, we talked on the phone and you said that the public got the scare first.
That's
from
right.
That Women's Health
It was
Initiative.
in the Washington Post, it was in the New York Times, and
you didn't know what to say.
We hadn't seen the study, so we were quite helpless, and people just started coming off of their hormones. And months later, we started to see people walking through the door with Suzanne Summers' book, The Sexy Years.
Yeah.
1, 2, 3, couple of different patients walking through the door, and actually women know what they want. And women were looking for bioidentical or natural, what they at that time were terming natural hormone replacement therapy. I didn't know anything about it. So after seeing probably more than a dozen women walking through the door, I decided
so
that
they walked in with the book.
They would walk in with the book, or they've read it, or...
Were you skeptical at the beginning?
Completely. My whole group was skeptical. And, you know, the only thing you could think of was Suzanne Summers is teaching women about hormones.
Okay.
And actually, in reading the book, it became clear to me that there probably was a large body of evidence that I absolutely had no idea existed. And it propelled a personal mission on my part to really start to look at that evidence.
Like, what did you do?
Well, I started to delve into PubMed research files and read every common book that was on the market, which interestingly had a lot of research references in it, and started digging up all those references. I built a huge file.
Now,
it took me really almost a year.
Okay, now anticipating this interview, and I'm sorry to interrupt, but, you know, I've told a lot of people that I'm interviewing you on bioidentical hormones, a lot of controversy behind it, and I'll hear this from time to time. There's not a lot of data supporting the benefits, and you say that's not the case.
I have definitely come to the conclusion that that is not the case. If you think about when we talk about bioidenticals, first we have to identify what are we talking about. Many people have referred to this as natural.
Okay.
But the bioidentical actually means that it's molecularly exactly identical to the molecule that your human body makes. So it isn't a soy estrogen, it is not a horse estrogen, but it's actually human identical that binds to your molecule exact.
Okay.
Interestingly enough, there are many patented products on the market that have FDA approval and are prescribed on a routine basis, such as Climera patch and Vivel dye. There's plenty of bioidentical products that are currently already on the market, supported by many studies and research, and FDA approved. So that starts the research behind it.
So what's the big advantage, though? What does it mean to the woman, bioidentical hormone, as opposed to synthetic? I mean, do you get better results? Do you feel better?
I've definitely seen that there's better results. Just to give you an example, if you look at the literature on just shifting women from synthetic progesterone, which is called progestin, to a natural progesterone, there are large studies from Mayo Clinic and from the regular medical literature that show that women feel better, less anxiety, better sleep, less bleeding, less cysts. In addition to the data, what I found from my own personal experience of switching people on to natural progesterone, just as an example, is exactly that women sleep better, less anxiety, better moods, not mood swings, better control of their mid-abdominal weight gain, so on and so forth.
What are the fears, or I should say misunderstandings or misconceptions about bioidentical hormone replacement therapy that are out there that you hear and they're just not true and they're common?
Well, I have to say that the absolute number one fear expressed by women coming in through the doors looking for any kind of hormone replacement therapy is the fear of breast cancer. And if you think about it, a great deal of that fear is actually fueled by media. And also, if you think about it, the mortality rate for osteoporotic fractures is much, much greater than that for breast cancer. There's 8 times more cardiovascular mortality than breast cancer. There's 8 times, 4 or 5 times more the mortality from stroke than breast cancer. And actually, in the long run, all of the other diseases cause much more disease burden in our society than breast cancer.
Okay, now the studies that showed that it did increase breast cancer, were they talking about synthetic hormones or different ratios?
They were, and actually that's exactly where I was going to go. So the first thing is the disease burden from breast cancer is not as great as one thinks. The second part of the equation is that women do not get breast cancer and heart disease and stroke when their hormones are at very high levels when they're in their 20s and 30s, and their hormones are balanced. That's not when they get breast cancer and heart attacks and stroke. They start to become at risk for these things when the hormones come out of balance. And let me explain to you what I'm talking about. Let's just take a simple example of estrogen. The normal estrogens in the body actually are 3. There's estrone, E1, estradiol, E2, and estriol, E3. Out of those 3, the most cancer protective and cardioprotective one is E3. And actually in our 20s and 30s, that one's present at almost 80%. Whereas E1, which is the breast proliferative and the clot promoting one, is present at 10%. As women enter the years before menopause, that ratio changes dramatically. The E1 goes from 10% to 80%, produced primarily in the adrenal glands and the fat tissue. And so even if a woman never ever considered taking a supplemental estrogen, she would automatically be 80% estrone E1, which is the hormone that actually causes breast proliferation and increases our clotting ability. So that's one thing to think about. If we look at the hormones, for example, that they used in the WHI study, which you were asking about, was it because they were synthetic? Indeed, there was a component of the synthetic hormone that was not favorable. In other words, 50% of that hormone Premarin is estrone. And when taken orally, that is even further converted. Even the small amount of estradiol is converted more to estrone than other things. So it's become very clear that not only was there an unfavorable estrogen ratio, but that there was a synthetic progestin used, which now has been found in 5 separate studies to be related to an increased risk of breast cancer. And as a matter of fact, 2 years later, when the WHI study published their estrogen-only result, their breast cancer rate was much lower when they took the progestin out. Of course, that didn't make the media, but it's very, very clear that, we have to understand what happened in that study. I think that study actually gave us great information. The first thing is that oral estrogens and estrone used in older women, 63 average age, and in their memory study it was 71, didn't give you a very favorable result. We have lots of studies now from the cardiac literature, from the internal medicine literature, that are actually showing that hormone therapy used in younger women and using more of a natural balance actually protect the body, like we expect it to protect the body.
So what type of patients do you see in your practice?
Okay, I have the woman in her late 30s walking through the doors, can't sleep, having anxiety or panic attacks,